Welcome. I'm Dr. Malia Jensen, and I'm a board certified family physician. This is Buddy Blue. This is my co-host from heaven. This is Tucker. And I don't know, lately I have really been missing him. I follow somebody on Instagram. He might be on Facebook as well. Piper's dad. And oh my gosh, the relationship he had with Piper is the relationship I had with my Tucker. And I'll tell you, you have one dog in your lifetime that is a Piper or is a Tucker. And Tucker was that dog. And so he helps me out. He's co-hosting from heaven. So I appreciate his help. I appreciate him supporting me and being by my side. I know you guys might think that, or you might not think that's weird, but I'll tell you what, he just the thought of him gets me through. So today, kind of waiting for everybody to jump on here. We are live on Instagram and we are live on YouTube. And if you are on Instagram right now, you will see that I have a live fundraiser for rescue, rehab, and rehome. I do this every day, or excuse me, every weekend live stream. And I put rescue, rehab, and rehome as my fundraiser. That is where I got Buddy Blue. And it's also where I got Tallow. So they mean a lot to me. And that organization means a lot to me. And so if you have it in your heart and you want to give $1 or $2, it all adds up. I do it once a month. I try to raise $100. Good morning, Angel. I try to raise $100 a month. And I think I know they are, because they've told me that they're very appreciative of everything that we do. So if you guys are on YouTube and don't have that link, maybe message me and I will send it to you. But you Instagrammers have been doing very, very well in raising money for them, and I really appreciate it. Also on Instagram, you will see a link for Dr. J's apparel, the Ignorosis line, the No Longer Bamboozled line. So look into it, see if there's something that you might like. Helps the channel. If you guys want to subscribe, there's small donation, support, I guess, monthly, $2.99. So anyway, those are just ways that you can help support the channel. Just simply hitting the thumbs up can support the channel. So if you're listening right now, you're on YouTube or Instagram, please hit the thumbs up or the heart, and that does help. If you are not subscribed, I would appreciate that too. So just hit the subscribe button. It's free. All this is free. There's some that's not free, and it's your willingness to support the channel. Okay? Habanero, good morning. So it looks like we have one listener from Malaysia. Where are you guys listening from? What city, what state, what country? Where are you guys from? I'm always interested. So is Buddy Blue. He's sleeping right now already. Today I want to talk a little bit about the gut biome. We have not talked about this for a long, long time. And I think it's a buzzword. I think that they can sell a lot of products to us in order to heal or cure our gut. We talk about the biome, and I don't think we actually know everything. Not that I expect you guys in just one short classroom session, learning all about the gut biome. It's a complicated thing, and I just want to make a couple connections for you, and I think it will help, okay? But we have a gut biome. We have bugs, bacteria, that live in our gut, in our bowels. And we develop the first bugs during birth. When we are born, and we are born via vaginal delivery, we get mom's vaginal bugs and bowel bugs, and that helps us develop our own biome. Okay? Now, A caveat to this is if you're born via C-section. If you are born via C-section and the doctors or the nurses did not wipe mom's secretions on your mouth, mouth and nose and face, then you have likely developed a gut biome that is void of Bacteroides and Lactobacillus, and those are common bacteria that grow in our bowels. Instead, when a baby is born via C-section, they get what's in the environment, the hospital environment, the hospital skin bugs, and the environmental bacteria, which is usually staph and Klebsiella, so Staphylococcus and Klebsiella. How can we, if the doctor or nurse did not wipe secretions from mother into baby's nose, eyes, mouth, how can we make up for that? Well, you can breastfeed. Breastfeeding will correct things. You'll get bifidobacterium from the breast milk, and by the age of 3 to 5, then let's see. All right. Just doing some cleanup work, you guys, while we wait for Lucy to jump on. She's my blue wrencher, my blue shield on YouTube. Seems like YouTube is where we usually have the problems. Yes, Ruth, nursing the baby does help with the that's breastfeeding. We'll give it bifidobacterium. And therefore, by the time the toddler is 3, 4, 5, the gut biome is usually stabilized by then. Now, we will develop gut bacteria or a biome bacteria according to what we eat. If you eat a bunch of fiber and plants, then you will develop bugs that eat that. If you eat a carnivore diet, you will develop bugs that eat that. The types of bacteria, there's maybe 4 main types of bacteria that grow in our gut. Firmicutes, that's like lactobacillus, Bacteroides, and that makes up, a third of your gut bacteria is Bacteroides. Okay, actinobacteria and proteobacterium. Those are the 4 main types of bugs that grow in our colon. And they multiply by what we feed it, just like I said. Now, I don't even know where to go with this. This stuff, I usually think that you guys are going to be asking me questions, but I think when we talk about the gut bacterium and our diet, a lot of us will shift gears and say, well, if we consume what Dr. J calls a crapola diet, meaning they're eating processed foods, seed oils, and sugars, you are going to grow bacteria that consume those things. And those bacteria are not always healthy. When we consume those particular items, we cause a lot of inflammation and oxidative stress. The lining of our bowel walls is made up of a single layer of gut cells, and they're stuck together, and they don't have any gaps between the cells in the wall. When there's inflammation in the gut wall, we cause a separation in those enterocytes, those gut cells. They should be stuck nice and tight. When they're not, a gap appears, and that we refer to as leaky gut. Some people will tell you there's no such thing. I can't imagine that there isn't such a thing, because one of the endotoxins. So bacteria have endotoxins. They have their own toxins in them, okay? And one of those endotoxins is called LPS, lipopolysaccharides. Let me see. Let me make sure I don't have any. Make sure we don't have any questions here. I'm just trying to, if you guys have a question, put a Q or a QQQ so I can fix it or find it and answer your question. Yes, habanero, I agree that doctors do take the easy route because you can deliver a baby much faster via C-section. But there's a lot of things, I'm sure in emergency situations, a C-section is necessary. But I think we jump to it, the parent, the mother, jumps to it right away instead of wanting to deliver her baby naturally, vaginally. Okay, doesn't look like we have any questions over on YouTube. What about you guys over on Instagram? Ruth adds that hand sanitizers are not good for our microbiome. Can adults improve the microbiome? Absolutely. It depends on what you eat. If you are eating a crapola diet full of sugar, seed oils, processed foods, you are going to feed those bacteria. Symptoms that are common with the gut when it's consuming that is gas, bloating, cramping. And so one of the things I do when people tell me that they have these symptoms, I say, you need an elimination diet. Well, what do you mean, Dr. Jensen? You need to get rid of the plants and the carbs, which is the plants are carbs, but you need to carb restrict. You need to plant restrict. Plants are very irritating to our lining. Fiber is very irritating to the lining of our bowels. People, gurus, doctors, they'll tell you you need a certain amount of fiber in your diet in order to feed the biome. Well, if you are eating a carnivore or a ketovore or just a low carb diet, fiber is really not necessary because when you're eating meat, eggs, butter, just animal products, fat, you are going to absorb all of those nutrients in the small bowel. A majority, over 90%, will be absorbed in that small bowel. Whereas waste that comes out from the large bowel when we consume a crapola diet is what the bacteria are fermenting on. They are fermenting, they are eating it, and then the gases that are coming off of that consumption will cause your symptoms: gas, bloating, cramping, just a really irritable gut. And you go to the doctor and the doctor goes, oh, it sounds like you got irritable bowel. And their first thing is, why don't we just give you a medicine? So you continue to eat your crapola diet. You continue to consume a medication or be told to consume fiber in order to heal your microbiome. Well, you guys, I'm telling you what, you can't eat enough fiber that will make up for your crappy diet. It just isn't going to work. So an elimination diet will help calm the colon, will decrease the inflammation, will close up those gaps and allow the bowel to heal. Because the food, if you're on an elimination diet with meat, salt, water, for instance, nothing's getting to the colon, so you're allowing it to heal. Inflammation is going down because the things that you're eating, plants, cause the inflammation. All right? What else besides the plants? You know, the phytates and the oxalates and the lectins, all of the things that you're consuming. But what about this thing? There's good bacteria and bad bacteria. What do we say about that? You know, bacteria ferment fiber. and it produces short chain fatty acids like butyrate. When certain bacteria overgrow, they can produce the LPS, lipopolysaccharide, which is a very inflammatory endotoxin. Leaks out of the gut, leads to systemic inflammation, but a healthy gut will keep the LPS in the gut. Fences make good borders, right? So you want a strong gut with no gap junctions that will keep the LPS where it's meant to be and not in the bloodstream. By the way, when it gets into the bloodstream, what do you think picks up the LPS? Our body recognizes it in our bloodstream as a foreign body, foreign substance, this endotoxin, right? What do you think picks it up? What is it? Should we eat raw meat? Ruth, that is up to you. I've never been a fan of raw meat. And here's a question. Ruth also asks, what do probiotic supplements, what role do probiotics play? Well, if you're a probiotic is giving your body more bacteria, right? And honestly, do you think that you could just give a probiotic or give bacteria in a powder form or a capsule form and expect it to grow? These are live cultures. If anything, Ruth, if I was just trying to heal my gut, I would pick stuff that's already fermented. I would do kefir or something like that, even yogurt. I would do something like that if I felt like I needed to not heal my gut, but spur it along. Okay, there's prebiotics and there's probiotics. I'm not really a fan of any, okay? Although it's been suggested to me that because tallow has such a nervous gut, stress can cause gut problems. You guys know this. You get all nervous and you'll get diarrhea. The hormones caused by stress, so epinephrine, norepinephrine, and cortisol, cause vasoconstriction. So it deprives the gut of oxygen and blood, feeding that. So there's no absorption going on, and you eat food and it just goes right through you. So it affects motility, it affects the pH, it affects the whole environment. Stress does. It also causes mast cells to release histamine. And now you got a histamine problem in your gut, okay? Stress is a huge one. Antibiotics are huge. Plants and the phytates, oxalates, and lectins. If you get Lyme disease, that's a huge gut transformation. It will affect your gut. What else besides Lyme? Clostridium, C. diff. C. diff will cause it. Changes our bowels. Ruth asked, should we eat fermented foods? Initially, I think if you're transitioning from a crapola diet to something else, I think eating fermented foods initially is a good idea. Mixing a bite of fermented food and a bite of say, your carnivore diet. Okay. Ruth asked, do bacteria make vitamins in vivo? Yeah, they help to make something like our B vitamins. But let me explain something to you. Yes, our bacteria can help make these things. We have to get it in our diet. But the bacteria themselves can help make some B vitamins, for instance, okay? However, the foods we eat will determine whether or not we can absorb it. So if you're eating a bunch of plants with phytates, oxalates, and tannins and saponins, they decrease the absorption of our B vitamins. So you could make all you want, You can take in all you want, but if you can't absorb it and use it, then we have a problem. Phytates and oxalates decrease absorption of B vitamins, calcium, magnesium, zinc, selenium, amino acids. So there goes your protein. So that is why when I go buy a steak for $30, I'm not going to eat plants with it because I'm not going to be able to absorb all of those amino acids. So I make my $30 steak worth about $5. Not in my best interest. Okay? No, I have not, Patty. I have not read. I have recently listened to Dr. Stasha talk about vitamin D and our sleep cycle. I believe she is a neurologist. She was doing a lot of sleep studies. I don't know. I couldn't verbatim repeat what her studies are, but yes, I have seen some of her interviews on YouTube. Let's see. Habanero has made a choice never to eat plants again. Crypto says, where is the research on fecal transplant? Very interesting data on fecal transplants, especially with chronic C. diff infections, where these people are miserable, and you take a fecal transplant from somebody that has a healthy gut bacteria, transplant it into the person has chronic C. diff, and it does help, because you could give the antibiotic for C. diff, okay, or the antibiotic for Lyme, but this LPS, this endotoxin, can survive or build up a resistance, and it stays in the tissues. It could stay forever in your tissues, okay? And so even if you get a fecal transplant, which is I think there's great research on it, but if you continue to feed your body a crapola diet, that fecal transplant will not last. Within 2 weeks, you can change your natural bowel flora, okay? You'll just change it. What they eat, what you eat. There's not really any good or bad bacteria. You got bacteria that eat carnivore, or you got bacteria that eat vegan, or you got bacteria in the in-between, okay? My take on berberine, I would say, Jean, what would you be taking berberine for? How about that? Okay. Looking for questions. Oh, God, back to Yuli's. Yuli, thank you for getting me back on track. So the question was, when LPS gets in our bloodstream, what picks it up? Yuli says macrophages pick it up, or the white blood cells. Well, how about lipoproteins? How about LDL, IDL, VLDL, HDL? They pick up the LPS. Remember, the lipoproteins help with our immune system. And so since the body recognizes LPS in the bloodstream as a foreign body, so to speak, it develops an immune reaction to it, an inflammatory reaction. And lipoproteins act as a sponge to pick up the LPS, the endotoxin. So the LDL is a primary defense system to bind and neutralize LPS. It does that so the LPS doesn't continue to trigger a massive systemic septic shock. So we have an immune system, and LDLs and IDLs and HDLs all play a role. VLDLs, they all play a role. One of the things that LPS does in our body that could end up raising LDL cholesterol. So hear me out. LPS actually makes PCSK9 more active. More PCSK9. PCSK9 in our body will decrease or destroy LDL receptors on our liver. Our liver cells have LDL receptors, LDLR, okay? And they're a certain amount on the surface of these cells that when LDL is being recycled back to the liver, it goes into these LDL receptors, into the liver, and then the liver says, okay, we don't need to recycle you. I'm going to get rid of you out through a bowel movement, bile. Or I'm going to recycle you, all right? If LPS is in our bloodstream and it increases PCSK9, then PCSK9 will destroy LDL receptors on the liver cells. So less doors are available for LDL to come in and get either recycled or eliminated in our bowel movements. When that happens and there's less LDL receptors, then LDL goes up in our bloodstream. So when you measure it, you'll see high LDL. This is only one aspect of something decreasing LDL receptors on our liver. Menopause does it, hypothyroidism does it, high saturated fat diets do it. A lot of things will downregulate LDL receptors on our liver, okay? And one of those things is a bad gut. If a bad gut gets leaky, inflamed, and the gap junctions open up, then LPS endotoxins from the bacteria, they're supposed to stay in the gut, get into the bloodstream. One of the first lines of defense is an LDL or IDL or VLDL or HDL. They prevent us from getting septic shock from the endotoxins. LPS also affects the LDLs that are in the bloodstream. Okay? So not only do LPS increase PCSK9 that destroys the LDL receptors, but LPS also goes to work on the on the LDLs. And I just said it causes oxidation of those LDL particles. They're sitting in the line of fire in your bloodstream. LPS can go to work on those lipoproteins and degrade them into small, dense LDLs. Now you know another reason why small, dense LDLs can be high in your bloodstream. You know that high-carb diets increase small, dense LDLs, but did you know that LPS endotoxins from a bad leaky gut can do the exact same thing? And usually the leaky gut is caused by the carbs and the plants and all of that. So it's hitting them from both angles here. So doctors, I don't think that they systemically ask you the right questions. For instance, if you have a high LDL, do they look at your thyroid? Likely not. In fact, they might look at it but say it's okay because you fall into a range, and they only look at TSH, of course. It'll fall into a range all the way up to 4. Well, my goal for a TSH is less than 2. So subclinically, somebody who's got a 3 or a 4 TSH has subclinical hypothyroidism. That will cause high cholesterol because it downregulates LDL receptors on the liver. So from that perspective, I don't necessarily think that doctors know all of the reasons for LDL being high. They'll just go, oh, well, you have high LDL, here's your medicine. I make a diagnosis, I write the script. But I look into all of the reasons, and I might go through I go through a questionnaire, and some of you might say, oh man, my gut is so bad. Or they'll say, I have a history of Lyme disease in my history. I go, oh my gosh, because Lyme may not ever go away. And that increases LPS. It increases gap junctions and leaky gut. But we don't, as doctors, tie everything together. I don't believe, okay? Maybe I'm assuming and I shouldn't assume, but you guys have told me on numerous occasions that, the doctor says my LDL is high and they want me to take a statin. I'll say, oh, well, how's your thyroid? Well, they said it was good. How's your gut? Oh, geez, I just got an irritable bowel. Well, did they give you medicine for it? Yeah. I got belching and burping and, well, okay, well, that could be a reason why your LDL is high. They're just going to give you a medicine when you can just fix your gut. Or menopause, estrogen actually, keeps down PCSK9. And when we don't have estrogen, PCSK9 elevates and then it destroys the LDL receptors so did we even take into consideration that you're menopausal and you have higher LDL? None of these things, you guys. If your triglycerides are high and your HDL is low and you're not really eating that many carbs, you're eating some, but you can say, gosh, not that many where my triglycerides would be that high and my HDL would be that low. Well, I say, hey, how's your gut? Oh, geez, I think I got leaky gut. I'm just a mess all the time. It's embarrassing. And I'll say, oh, well, you probably got LPS, endotoxins. You got leaky gut. Leaky gut will increase LPS in the bloodstream, and LPS can increase triglycerides and really lower HDL because HDL remember, is a lipoprotein that's trying to suck up all the LPS. It's really amazing how our body works. But again, if we reduce the whole thing to high LDL, here's your medication, or high LDL, you have a heart attack. We are, as doctors, are basically reductionist. We are not even using our thinking cap, okay? Patty asks, what is my opinion on Synthroid versus Armor? Well, Synthroid is synthetic, man-made T4, which is all fine and dandy. So our brain releases TSH, thyroid stimulating hormone. TSH comes down and tells our thyroid to produce 100% of our T4. And then maybe 20% of our active T3. The remainder of the active T3 comes from the conversion of the inactive T4. Synthroid is inactive T4. If you take inactive T4, you are praying that the T4 will convert to T3 in the periphery. Well, how do you know? You're just measuring TSH, okay? Which is really not a thyroid hormone. It's a pituitary hormone. It's in your brain. It's not in your thyroid. If you have a problem converting T4 into T3, giving more T4 is not going to help you. Makes sense? Whereas Armor is natural T3 and T4, and there's T2, T1, there's all of it in there. But since it's in a concise amount of T3 and a concise amount of T4, it's hard to adjust. Do I have some people who are on synthetic T4 and Armor? Yes, because we could give them Armor and then their T3 goes sky high and their T4 is kind of underdosed and then their TSH will be high. And so I look at all of these things, but I also have to get a reverse T3. I need to know, is your T4 converting to active T3 or is it converting to reverse T3, which is inactive? It does you no good. In fact, it blocks the T3 receptors on the cells. I can tell by getting a reverse T3, and if it's over 12, you are not really converting all of your T4, whether it's naturally from your thyroid or it's synthetic T4. Okay. Patty says, what about Cytomel type drug? Well, Cytomel is T3. Again, it's synthetic. It's not natural. So it's a synthetic T3. So yes, some people take synthetic T4, Synthroid, and synthetic T3, Cytomel, in order to get their thyroid in order. It's possible. There's a lot of doctors that do not know anything about the thyroid. And I'm not telling you that I'm an expert, but I know enough that if you come in, Patty, and you say, I'm just not feeling well, and the doctor says my TSH looks fine on paper, but I don't feel good, then we got to dig deeper. Because your T3 really should be around 3 to 3.5, especially if you are on just a normal diet, that you're eating carbohydrates and you're eating some fat and some protein. You're just on a whole food diet, or even on a standard American crapola diet. Okay. T3 should be in that range. Now, on a carnivore, I give it a little less emphasis because you're not eating carbohydrates. You really need less T3 for the active form. So your T3, it could be 2.8, 2.9, and I'm going, okay, they're carnivore, we're good. TSH is fine, T3 is fine, T4 is fine. These are good questions. Very good questions. Thank you. Henry says, most MDs, in my experience, look at one factor at a time. Yeah, I mean, yeah, I guess that, I don't know. It's tough. I think the reason doctors don't want to do all of these panels on people when they request it is, one, they might not know how to interpret the labs, and two, maybe Henry's right, is they just want to focus on a few things, get really good at, I don't want to say good, bad, or good, I don't know, but they get a specialty where they're just seeing people and they're doing a lipid panel and they got everybody on cholesterol lowering medications without looking at anything else. They don't look at thyroid. And if they do, the reference range is so wide that they're missing so many people who aren't feeling good. Okay. They aren't looking at kidney function the way I think they should. They're not looking at the EGFR. And, half the carnivores out there, or people who work out, will have an EGFR on a regular chem panel, estimated glomerular filtration rate, that's really low. Well, you didn't take into consideration their age, their sex, their activity level, their dietary level. You didn't ask them anything, and you just now gave that person a diagnosis of CKD, whether it's stage 1, 2, 3, 4, 5. They gave them that diagnosis, but you didn't look into it. So all of these people, if somebody comes back with a low EGFR on a chem profile, on a chem CMP on your labs, it's called a CMP, complete metabolic profile, and your EGFR, it comes back low, meaning less than 90, most doctors will say, if it's greater than 60, you're fine. No, you're not. That's already stage 2 chronic kidney disease. Look into it. So I order a urine microalbumin. I want to see, are you spilling protein in your urine? And number 2, I will get a cystatin C. I want to know the accuracy of your kidney function. I want to know the accurate EGFR, the glomerular filtration rate. I want to know exactly what it is. I'm not going to guess. But doctors don't know what cystatin C is, and they rarely get microalbumin unless urine microalbumin, unless you're a diabetic. And then insurance pays them extra to get a urine microalbumin. So then they'll do it. And if it's greater than 30, they just send the patient to a nephrologist, okay? A kidney doctor. They'll just send them. They'll punt. I'm not dealing with this. So they can do the test, as required. They'll get paid for it. They'll get their incentive, I should say. And then it comes back where they don't know what to do with it. They'll punt, and then they don't see the patient again. And that's actually good for them because it's too complicated. They'd rather see colds and UTIs and flu and all of that. Rashawn, you're going to have to actually talk to your doctor about that. I don't know the answer. Habanero says, my EGFR was 59. They're flagging me. You should be flagged, Habanero, but you really should get a cystatin C and a microalbumin. They're probably, if you're working out a lot, lifting weights and, eating a high protein diet, you need a cystatin C and a microalbumin. Yeah, Habanero's carnivore. Don't rely on your EGFR. I'm guessing you lift weights too. So you got a relatively higher intake of protein and you're lifting weights. Your EGFR of 59 is probably not accurate. Henry says, my MD missed 2 occurrences of hyperparathyroidism because he didn't understand that elevated calcium along with low vitamin D is a strong indicator of hyperparathyroidism. Yeah, Henry. Again, please hear me out. Your doctor was likely looking at the reference ranges, and they will, on the reference range, will allow calcium to go up pretty high before anybody does anything with it. And so I pick up a lot of parathyroid tumors because I look at the calcium, and my cutoff is 10.0. If it is 10.1, you're getting checked. What do I check them with? I will check a PTA, an intact PTH. Yes, I will get a vitamin D, but Henry, it's very important to get a active vitamin D and a stored vitamin D. Henry, you could have been kind of an overweight, have a lot of body fat, and you are not going to absorb vitamin D. And so your vitamin D level will be low. Does that mean you have hyperparathyroidism? No. But in conjunction, a low vitamin D, again, I go just the extra 9 yards. I want an accurate diagnosis on why your vitamin D is low. I'm going to look at, an active and a stored vitamin D. Makes sense? Also, people who consume in an incredibly large amount of vitamin D, they will start getting gut reabsorption of calcium. And again, because of the wide range of the calcium on the reference range on your lab paper, doctors miss it or they don't think about it. That's, again, where I start looking anything over 10.0. So if you guys have your complete metabolic profile and your calcium is 10.1, then it needs to be looked into. You need to have your doctor order it's called intact PTH. Intact PTH. And then we won't miss stuff. You have to be your own advocate. I think we give doctors way too much credit, you guys. Yeah, we went to school and we spent a couple $100,000 to get educated. And I think people give us way too much credit. You hold us at such high levels when we actually put our pants on the same way. We brush our teeth, we comb our hair, we do the things just like everybody else. You should not hold somebody to those high standards. I'm not saying don't trust them. We have to get their opinion, but we as a consumer of healthcare need to educate ourselves. I doubt that your doctor knows that your leaky gut releasing LPS into the bloodstream is raising your LDL. I can't even imagine that there is a doctor, well, There's very few. How about that? There's very few doctors who know that that could be a problem. Their first intuition is high LDL, prevent heart attack, give the medication. They follow a standard of care. Doctors follow standard of care. It protects them. One, protects their pocketbook. They get paid. If they follow standard of care, you give a statin to every diabetic, you give a statin to every elevation of LDL, you give a blood pressure medicine, an ACE inhibitor to every diabetic, you treat according to their guidelines, you get paid. And you, as a doctor, have less risk of getting sued because you follow standard of care. Make sense? Hey, you guys on YouTube, can you hit the thumbs up? Hit the thumbs up. Let's try to get up to 35. 35. One French poodle asks, is colostrum good to heal the gut, especially after healing from SIBO? SIBO, small intestinal bacterial overgrowth, is likely being fed by something you're consuming, okay? So by changing the diet within 2 weeks, you will likely heal the gut. Now, can we buy straight up colostrum? I don't know, okay? I don't know if that colostrum is real or not. I know that there are people on the internet. Good morning, Lucy. Yeah, please like and share. I appreciate that. Hit the thumbs up. We're at 22. Can we get to 32? Let's get to 32. Let's get 10 people to hit the thumbs up. I'm not sure that we can buy colostrum, pure colostrum. It could be fake. Can we buy lactoferrin? Same thing. I'm not sure that we can. There are people on the internet who sell their breast milk, and older humans buy it, not just babies. They buy the breast milk. There's colostrum. Can you make it? It must be synthetic. I don't know. One French poodle. What is the, I just don't know. And I think taking away what is causing a bad gut is better than trying to add something to a gut that's already messed up. Do one thing at a time. What is the word on nuts? Are there any that are good to eat as a low-carb snack? Asks Beefy B. Beefy B asks, are there any good nuts? All nuts are plants. I try to avoid plants at all costs. I drink some coffee. What is an UNC alert? UNC alert. Thank you, Patty. You guys, to help this channel, yes, on Instagram, you can support do a subscription and do all that. On YouTube, super chats and super stickers add up. It supports my channel. It helps me do what I do. I don't work in an office anymore. I closed my clinic a year in April, so it's been over a year. I see patients or clients. I'm not their doctor. They're not my patient. They're a client getting a doctor coach to help them with lifestyle changes. All right. I help them read their labs and then go back and talk to their doctor. I'm a family practice doctor. I've been in practice for 28 years. I'm board certified. I went to a DO medical school. I took an MD residency, and I took MD boards. Now, back to the nut question. I am currently doing an experiment. If there was one nut that I would put in my body, it would be macadamia nuts because they're monounsaturated fat. But I am finding, I've been on this, I can't remember, you guys might be able to help me out when I first told you I was going to do this. I know it's been over a month. It might be 2 months. I'm going to tell you, my body is not right. It does not feel good. It almost feels like before I started the carnivore diet. My joints kind of ache, my back and my shoulders are telltale signs for me where I just feel this ache. I don't have pain, so to speak. I mean, you could consider it a pain. Everybody has a pain tolerance, and I call it an ache. And the ache, I'm noticing the minute I get up in the morning, okay? I actually wanted to do a study to see if the monounsaturated fat increase and the saturated fat decrease would change my LDL receptors on my liver, and it would decrease overall LDL in my bloodstream. That was my experiment, not because I just wanted to add a macadamia nut to my diet, but that seemed like the easiest. I also added emu oil, which is mostly monounsaturated fat, and it comes from an animal, so you do get to avoid the plant monounsaturated fat, which is, for me, the best. But I am noticing, you guys, the addition of the monounsaturated macadamia nuts, I think has put me, it's spiraling me downward, back toward where I was before. And after this lab draw in August, if it did not make any difference, I can't see myself staying on these macadamia nuts. And I'm only doing 14 whole macadamia nuts a day. So I split it up between 7 and 7. The emu oil, I'm doing 3 of those a day. And I get a brand called Smidge. Can you just buy emu oil and drink it? Yes. It just seems a little messy to me. I don't know. I just want to try this Smidge. It's probably more expensive. Actually, you know what? I did compare the prices, and they turned out to be about the same. Ounce for pill ounce. Yes, Lucy, I do think it's not from the monounsaturated fat. It's from the plant aspect, the phytates, the oxalates, the tannins, the saponins. It's the anti-nutrients in the plant that I'm finding is causing the inflammation in my body, okay? And my gut isn't as good as it was on purely carnivore. Now I'm getting symptoms. It's the fiber, it's the actual plant, and I don't think my gut is as good. In fact, I think it's inflamed. Could I have LPS spilling out into my bloodstream, and that is basically going to increase my LDL? So why am I even taking in the plant? I should just stick to the emu oil. I was going for different direction on how I could increase monounsaturated fat. Some of you will choose avocado. I, for one, just don't enjoy it. I do not like avocado, okay? I could probably stomach it. I stomach sardines. You know, I just have to close my eyes and eat it and think it's tuna. Let's see. I'm going to... Suzanne says she got better taking high doses of pre and probiotics when she had C. diff, and she actually took no antibiotics. Wow, I'm proud of you, Suzanne. That's amazing. Ruth asks, PCSK9. It is, okay. Ruth, do you recall me talking about FH, familial hypercholesterolemia, FH? FH is genetic. It's either heterozygous or homozygous. Homozygous is very rare, like 1 in a million people, whereas heterozygous is like 1 in 250,000 people. Anyway, FH, to check if you have FH, you should check the PCSK9 gene, the LDLR gene, and the ApoB gene. So PCSK9 is produced in our body, and it is there to act like a security agent to take care of LDL receptors, all right? LDL receptors on our liver. We need a little bit of PCSK9 to help that liver tell that we want to recycle the LDL receptors. We don't just keep using the same LDL receptor over and over and over again, okay? they're recycled, they're destroyed, and new LDL receptors are made. If we have too much PCSK9 in our body, then it's super duper killing off our LDL receptors. Now LDL goes up. So I encourage people, instead of just taking say you're in the 400 plus club, let's just say you're over 200 LDL. You should know, do I have a PCSK9 problem? Do I have an LDL receptor problem? Am I a hyperabsorber and have an NPC1L1 gene defect in my gut? There are so many things. And all most doctors do is say, oh, high LDL, you're a danger. You're going to have a heart attack. Here's your medication. They don't look into what the cause is. In fact, let's just say that you are a hyperabsorber. I've found a few of you already as clients. I've asked you to get a cholesterol balance test, or you already got it, and you have NPC1L1 gene defect. What does that mean? It's in your gut. Your gut reabsorbs the LDL that the liver was trying to get rid of, eliminate from our body. It put it into the bile, and it comes out through the waste in your bowels. If you have high NPC1L1, you're going to reabsorb all that LDL instead of letting it go out as in a bowel movement. So now you recycle that LDL back into your bloodstream. If you give a statin to a person with high LDL and they're an NPC1L1 hyperabsorber, you're not going to do anything except lower the cholesterol production in your liver. Now the hepatocytes, liver cells, are depleted of their own cholesterol. Because if you give a statin, it blocks the mevalonate pathway in our body and also blocks the mevalonate pathway in our liver. So now your liver cells are choked off, or they're crying, they're screaming for cholesterol production. So then they try to hyperproduce more cholesterol. And now your cholesterol goes even higher. Your LDL will go even higher. Just because the doctor says, and then you know what he'll do? Oh, the statin's just not good enough. I'm going to add a PCSK9 inhibitor. Well, do you, like Repatha or Praluent, well, do you have a PCSK9 problem? Did that solve the NPC1L1 problem in your gut as a hyperabsorber? No. What would have been the better choice? Zetia will block NPC1L1 gene or 1L1 receptor in your gut. Just like that. Okay. But what if it was your thyroid, doctor? Exactly. Did you look at the thyroid? Ruth, did I answer your question in regards to the PCSK9? Okay. Once French Poodle says, I might be that person with a leaky gut and sudden increase in LDL. Exactly. Go on an elimination diet and you'll know. Go on meat, salt, and water. Go on a carnivore diet. Heal the gut. And then shortly thereafter, check an LDL count. One French Poodle. If you have leaky gut, you have to get rid of the inflammation. The inflammation, I would say, is 90% diet. Yes, it could be an infection. Yes, it could be C. diff or Lyme. Yes, it could be all the things, but I'm guessing 90% of the time it's going to be your diet that caused the leaky gut. Eliminate all of the foods and see what happens to your gut. It's gonna heal. It'll take 2, 3, 6 weeks to heal. Can C. diff stay in your gut? I think so. Even after you do, you probably have low level C. diff in your bowels, and your good bacteria that you're feeding is keeping it at bay. Okay? I'm not even necessarily think that you could have killed it off even if you took an antibiotic, okay? I'm just not sure. But I don't want to tell you yes or no. Yuli says, so the EGFR should be higher than 90 in order to consider that kidney function is still preserved. Yes, I think, they're going to tell you, well, you're getting older, Yuli, and your kidney function is just going to go down. Well, that's just simply not true. You don't have to get diseases as just because you're aging. I don't get that, where a doctor said, oh, you know what, you've lived a good life and these things are just going to happen. Your liver's just getting older. Your kidneys are just getting older. No, we're doing something that's killing off our liver or our kidneys. Yes, we're all going to die. And I hope that you know Jesus and you're going to go to heaven and I'm going to see every one of you. And you're going to say, oh, I listen to your live streams on Saturdays and Sundays. I just want to thank you. And I'll say, okay. But yeah, if your kidney function is going down, it's not necessarily because you're aging, but what are some things that could decrease your kidney function? I mean, simply eating fruit could decrease your kidney function. Just eating fruit could lower your kidney function. What, Dr. Jensen, are you kidding me? And yes, because if you eat fruit, one fructose molecule equals one uric acid molecule. And your kidneys might be struggling to get rid of that uric acid. So uric acid builds up. And also, I mean, just to reconnect the dots, if you recall me telling you that if you are low in glycine, which is an amino acid, if you're low in glycine because you're stressed and you eat a crapola diet and you have a lot of inflammation, you need glycine in order to take care of all that. In fact, if you're a carnivore and you're eating a lot of muscle meat full of methionine, you need even more glycine. And glycine is needed by the kidneys to get rid of the uric acid. All these dots connect, you guys. Okay. So that's why I take into consideration when you guys sign up for a consultation, I ask about your history. But I also ask about, what are you eating? I want like a 4-day diary of your foods that you're eating. What does your exercise look like? What does your sleep look like? What is your stress level? How are your friends? I'm asking all of these things. I'm seeing you as a person. I'm not just reading your labs. Although you guys like when I read your labs, you'll say, I didn't know that a low anion gap was a problem. I didn't know ELK phos over 100 was a problem. I didn't know these things. Oh my gosh, you found out all these things. And then I'll say, yeah, but because you're not sleeping and you're only getting 4 hours of sleep, you're in a chronic sympathetic overdrive, and then stress messes with your bowels and stress messes with your LDL. And I mean, I could go on and on and on. And I know I probably missed something. And most of you who have read my reports that I send you will say, oh my gosh, I think this is almost more than I could have asked for. It's way too much. I can't even understand all this. That's why we go over it. Some of you guys just choose to get my report and then you don't want to do a consultation. It maybe not right away. And that's fine, a video consultation. Ringy says, high LP little a, what is high? ApoB is high. What is ApoB high? And a calcium score of 61. Also factor 5 Leiden positive, I'm guessing. Age 66. So I don't know what, if you think LP little a is high, I'm guessing you think it's over 25. And your ApoB, I'm not even going to go there because ApoB is a protein that's on LDL, VLDL, IDL, LP little a's. It's just another benchmark where it gets doctors to say, oh, your ApoB is high, we got to get you on a medication. Nonetheless, Ringy, you have an LP little a, which is a blood clot risk factor. Okay, it is. High LP little a helps to make blood clots. We need blood clots. We just don't need an overactive LP little a. Now you mix that with factor 5 Leiden disease or disorder or gene. Now that's another blood clot risk factor. And did you check your fibrinogen? Did you check a D-dimer? Did you check a prothrombin level? all of those, if you start adding up all of the clot risk factors, puts Ringy at risk of not plugged up arteries from calcified plaque. It puts you at risk of a blood clot breaking off and causing a heart attack or a stroke. So if Ringy says, oh my gosh, my LP little a is a little high and my factor V is high, and I kind of eat a crapola diet, which now makes my arteries really, really injured, a high LP little a and a high factor V isn't going to do anything to you. Do you know how many factor Vs I find? And they're not having heart attacks or strokes, but they're healthy, meaning their arteries are healthy. If you get an injury, like you smoke or you drink or you're eating sugar or have smoking, drinking, sugar, high insulin, all of those things, heavy metals, microplastics, all of the things that can cause an injury to the lining of your artery. Now LP little a rushes to the injury and tries to clot it over. And factor V is going to increase the clotting factors and your fibrinogen and your factor VIII. I didn't mention that one. That one's a good one to check. Again, as long as you don't have an injury to the lining of your arteries, those clotting factors are a little less risk. But maybe Ringy is a candidate to take something like lumbrokinase. Lumbrokinase will see fibrin and break it down. That's a good thing. It's called a fibrinolytic. We don't want clots just hanging out and increasing our risk of heart attacks and strokes. Okay? So I don't know what your definition of high is, but hopefully that made some sense to you. Let me make sure. Lisa says, my EGFR has been in the high 80s. It fell to 58 this year, and I'm trying to understand why. I would look around. And honestly, I would get a cystatin C and a microalbumin. Check for protein in your urine. Okay. Anne Marie asks, what about Repatha? What about Repatha? It's a PCSK9 inhibitor. What would you like to know? Ringy says, how do we schedule a consultation? Email me at ironladydoc, IRONLADYDOC at AOL.com, AOL.com. Good morning, Sheila. SRT, I do not have a website. I use Instagram, YouTube, Rumble, Facebook as my websites. Most everybody, in order to schedule a consultation, will email me at ironladydoc@aol.com, and I will send you forms. I will tell you the fee schedule and how that all works, but it's a two-part. One is me initially reviewing, spending time, usually a couple hours and sometimes more, depending on what you guys give me. That's part one. And then part two is the video consultation if you choose to do it. Rose says, thanks for the ApoB explanation. Another doc on IG and Facebook who will remain nameless, thank you for telling me who it is, puts all of his statin eggs into that basket, also says inflammation is not a factor in cardiovascular disease. I can't speak for that doctor. I can only speak for myself. Combination of the thrombogenic hypothesis, the blood clot hypothesis, and LDL's hypothesis or the lipid hypothesis? Yes. I do not believe that it is in our best interest to have a bunch of small, dense LDLs in our bloodstream. They can be easily oxidized. Anything that can be oxidized is causing a problem. But when we have increased amounts of inflammation from our diet, from infection, from our lack of sleep, from our lack of sun, from too many blue lights, from microplastics, from all of these things that we're trying to live in a bubble, that is inflammatory. You can't tell me that the heart is the one organ where inflammation does not matter. It doesn't matter. If you treat the LDL and get it to 0, you're never going to have a heart attack. If that was true, then we would have eliminated heart attacks, because there's more of those kind of doctors who are treating LDL down to 0 or close to it, 20s, than there are of me that says, you know what, it's not really an LDL problem. You got a bad gut problem. You have a thyroid problem. You have a menopause problem. You have a stress problem. You have a no sleep problem. We're not healing our body. We're healing a number on a piece of paper, and it's not even working. So that doctor or all those doctors were on the LDL bandwagon, and then people are starting to get smart and say, it's not, you better count the particles. And then they say, no, particles don't matter either. It's ApoB. So ApoB is a protein on all LDLs, all VLDLs, all IDLs, intermediate density lipoprotein. All LP little a's have an ApoB. So if you add up all of those ApoBs and it's elevated, a doctor will say, let's just lower everything. Just lower the ApoB down to 30. And we will have eliminated all of the LDLs, all of the IDLs, all of the VLDLs, all of the LP little a's. But then they said, no, we can't really lower LP little a because it's genetic. Yet we can come out with a medication that will treat LP little a. Imagine that, right? So the ApoB doesn't necessarily require a medication right up front. It doesn't. But what if all of the ApoBs was because you have high VLDL? VLDL you can change with your diet. You don't necessarily need to take a Repatha or a statin to lower ApoB when all of your ApoBs are measured by the VLDL. The ApoB doesn't tell you, oh, you got a certain amount of LDLs, you got a certain amount of IDLs, you got a certain amount of small dense LDLs, you got a certain amount of LP little a's. It doesn't say anything like that. It just says ApoB in a number. But if you break it down and you know that your triglycerides are high and your HDL is low, if your triglycerides are high, you know that you have a lot of VLDLs. And your LDLs are kind of, right around 100, 120. Well, they'll give you a statin to lower your ApoB, which will lower your LDLs, and you need those LDLs. Do you think you don't need LDLs? I just told you need LDLs to pick up the LPS, endotoxin, from the bugs in your bowels that slipped through the walls and got into your bloodstream. Now, if you didn't have LDL, do you think you can get septic shock? Possibly. I don't know. Did that doctor, who am I speaking to? Rose? Did that doctor even think about LPS and the function of the LDL molecule, lipoprotein? I'm just going to lower it all. You don't need it. I'm going to prevent your heart attack. If you have a septic shock before that, you know what? I tried. I did my best. You were going to die of that anyway. I prevented the heart attack, and that's my goal. I'm the cardiologist. I'm the guru. I admit, you guys, I am not a guru. You guys are listening to me. You're believing me about my nutrition. I never even got 1 hour. Well, maybe I got 3 hours of nutrition in medical school. Yet you're believing a doctor who had no education. Do you know where I got my education on nutrition? You guys might laugh at this. Because we didn't get education in medical school, I got my nutrition education from Flex Magazine, Muscle and Fitness, Muscular Development, magazines. They gave me more nutritional information than my medical school. So, all these people that use the authority argument and they say, you're just family practice, or who are you that we should be listening to you? Don't listen. Don't listen. Go about your thing. Listen, put yourself in a silo and listen to the doctor that says, oh, LDL is bad. All LDL is bad. Yep, we don't need it. Let's just give you a medicine and we'll get rid of it. You have a choice. You do not have to listen to me at all. I could be wrong, but how do you know if I'm wrong without you doing some education? How do you know that those other doctors are right? in all honesty, if you guys accurately look at the cycles, well, there's studies that show. Really? Are there studies that show? Who did the studies? What was the data? Do you know how many people you would need if you've never had an event? Okay, that means you've never had a heart attack, you've never had a stroke, and your LDL's high, and they put you on a statin. Do you know how many people they would need to treat to prevent one death from heart attack and stroke? You would need to take a statin for 10 years. 100 people would need to take a statin for 10 years, a decade, in order to prevent one event. In the meantime, by taking that statin and blocking the mevalonate pathway, you lower your vitamin D, your sex hormones, testosterone, estrogen. You lower CoQ10, you get the muscle aches. You lower your production of vitamin K. And most assuredly, you're not going to have cholesterol production. Now, if you are willing to take that medication and suck up the side effects you may or may not have to prevent one event out of 100 people for 10 years, go for it. I have no problem. I just want you to be completely informed as to the pros and cons. That's all I'm saying. I mean, there's one doctor out there who I kind of respect. Will say, just take it every other day, a tiny little dose. Well, you're on it, and then you're off it. And then you're on it, and then you're off it. How is that going to be? I don't know. But how is that going to be for your liver? Your liver, it's like you shut the door and your liver stops producing, and then you take the medicine away and then it produces. And then it stops and then it starts and then it stops. And the liver's going, I wonder what this person really wants me to do. Make cholesterol or don't make cholesterol? I'm either going to make it all the time or I'm not going to make it. So your liver cells got to be in this like yin and yang and saying, I wonder what they want me to do. Should the liver cell make some more cholesterol? Oh, no, they're going to shut me down. Then I make it? No, I don't. I don't. What are the ramifications of that? Do we really know? Are we just making stuff up and say, oh, just take it every other day or once or twice a week? We believe all these things, and when I say it like this, it makes you kind of want to giggle. I mean, it makes me giggle to myself when I start talking about this because we believe the buffoonery so badly. I've been bamboozled, you guys. I was 100% bamboozled by the buffoonery. I truly believe that we really need to just lower all your LDL and you won't have a heart attack. I even said to the person, oh my gosh, your LDL is 160. Studies show that if you're over 130, without a primary event, then your risk of heart attacks go up, blah, blah, blah. And they said, Doc, I don't want to take a statin. I said, okay, don't take a statin. I'm going to put in the chart that I recommended a statin. And if you don't want to take a statin, that's up to you. I'm just going to document it. And I let it go. But then I always put in this little bit of sarcasm. And I'd say, and if something happens to you on your way out in the parking lot, don't say I didn't tell you so. I mean, what kind of a doctor would say something? Because I was so biased. I let it go, but I had to get in that last little jab. And that was early on, you guys, okay? Where I just say, I just need to inform you. I need you to have as much information so you can make a good decision. Yeah, but all the other doctors say this. And I said, well, here's a little more information, and now you're able to make a decision. If you only have one side information, high ApoB over a certain number, take your medicine. Then you're only going to learn that. Then you're going to be bamboozled by the buffoonery. They can talk you into anything. They'll use their authority argument, and then they'll use the whatever else argument, the ad hominems argument. They'll call you a dummy. They'll destroy your character. They'll make you feel like a zero. And then you say, I guess they're right. I should do what they say. No, get educated. Okay. Yeah, Rose, it could be frustrating to listen to that particular doctor, D Rose. Um, but some people might find it very frustrating to listen to me. I have been told that I never really give the answer to you, and you could be right on that, but maybe there's not an answer. Maybe it's a little mix of both. My goal is to get you guys to actually use your thinking caps instead of just being a robot, obedient, and just doing what they say. Maybe it's not for you. Maybe your LDL is high because you have a bad gut. Maybe your LDL is high because you just lost your estrogen and you're menopausal. Maybe your LDL is high because you have LPS endotoxin. Maybe your LDL is high is because you're eating a whole bunch of saturated fat and your liver can't deal with it. Maybe your LDL is high because you're an NPC1L1 hyperabsorber. All of these things. But honestly, just like I could look at a person in front of me, a lot of diagnoses will come to my mind. I can look at your labs on a piece of paper and a lot of diagnoses will come to my mind. I mean, just like lickety split, okay? But that doesn't mean I jump to conclusions. I need to really saturate myself with your labs and who you are as a person. How do you live your life? It's going to take me getting a little personal and saying, do you have a lot of stress in your life? Yeah. I never was really good at this. I grew up in a family where I was beat and, I was a lock key chain kid. I didn't really have a home. Whatever it is, and it gets personal, okay? Or my spouse keeps me locked up. They don't let me go out. They're jealous. Everybody's got baggage. You could say, I've never been out in the sun, Dr. Johnson. I work 12 hours a day. By the time I get up in the morning, I get inside and I get up in the dark. I go into my office with the blue lights and then I go home when it's dark. I've never seen the sun. I haven't seen the sun for 14 years. So there's a lot of things, okay? There's a lot of things to take into consideration. Rebecca says, what would cause an AST to go from 19 to 45? So basically doubling, and an AST to go from 19 to 81. That is those are high. I like an AST and ALT to be almost 1-to-1. And hers they were 19 and 19, almost 1-to-1. And I like it between 10 and 15. Now, could medications just kill off the liver? Absolutely. Not kill it off, but you know what I'm saying? Stress the liver and the enzymes go up. But more than likely, and maybe not in Rebecca, but in some people, when I see AST and ALT rising, I'm starting to look at, hey, do you still have a gallbladder? Hey, what are you eating? Oh, you're on a low-fat diet? Oh, okay, AST, ALT. Okay, what's your ELK phos? Is your ELK phos over 100? That adds some more dots to my equation. What is your GGT? Oh, now I can connect dots and say, yeah, it sounds like you got a sludge problem. You got cholestasis. Your liver and you're all backed up. You got fatty liver. Well, I didn't have fatty liver before. Well, maybe you just tipped the scales over. I don't know. I'd have to look at more, Rebecca. So if you're in a ketosis, I don't know how long you've been in ketosis. I also don't know what your level of saturated fat is. When we go into ketosis, to get ketosis, it doesn't have anything to do with how much fat intake we're taking in. It has to do with how many carbs we're taking in. When insulin goes below a certain level, because the carbs go down, insulin at low levels will cause the liver to start using fatty acids to make ketones. You cannot get ketones being made by the liver in the presence of high insulin, okay? Impossible. Peaceful, this is the kind of things that doctors do. And this might blow your mind. I kind of did when I read it. Peaceful says recently had a stent, and the doctor got down in Peaceful's face on the table and said, "Now you're going to take a statin?" As if, I told you so. Now you're going to take that statin? Had nothing to do with any injury in that lining. As if the statin could have prevented an injury because Peaceful ate a crapola diet full of processed foods, seed oils, and sugars. As if the statin was going to prevent their needing a stent. And you know what, Peaceful? Who's to say you even needed a stent? You know, they get paid to put stents in. And now that you have a stent, you're more at risk of having more stents. You're more at risk now of having a blood clot because the tip of the stent causes inflammation. And now you have an inflammatory trigger. So, you know, when narcissistic, egotistical doctors do that, that is not very nice, okay? That is treating Peaceful like a POS. That Peaceful is not human, has no feelings or emotions, and basically, doctor called Peaceful a dummy, or worse. As if it was Peaceful's had a deficiency of statin and therefore needed said stent. That is, what do you call it when you do that to a person? I can't think of the word. I don't know statistics on that, Electric Mayhem, on the number needed to treat post-stent. I don't know. Sorry. Henry says, I assume I'm a hyperabsorber. Zetia reduced my LDL by 60%. Yeah. Lucy says, how do you know if you have a leaky gut or SIBO? Symptoms: belching, bloating, cramping, gut, diarrhea, constipation, back and forth diarrhea, constipation, just a bad gut. A bad gut. You could, do you need a lab test? You could get a zonulin level. A zonulin level, okay? If zonulin is high, then LPS is probably a problem. If you have LPS in the bloodstream, then you have like leaky gut. LPS should stay where it's supposed to stay. Yeah, I agree. YouTube. Eating processed foods, nothing will change. Eating seed oils, nothing will change. Eating sugar, nothing will change. You can do all you want to do. You can take the probiotics and the prebiotics and you can do the thing, and you can't heal your gut. You'll never heal your gut. If you continue to eat those foods, you're just giving people money out of your paycheck every, yeah. Okay. Let's see. Beth says, I am 60 and have been wearing a CGM, a continuous glucose monitor. I am insulin resistant. I'm insulin resistant, meaning they have high insulin. I don't eat sugar, okay? I eat clean. I don't know what that means. I'm not trying to be sarcastic, but I kind of am, so I'm going to tell you. Do you eat clean? Does that mean you wash it off with soap and water? I don't know the definition of your clean. If you are eating clean fruit, fruit is a sugar, it's glucose and fructose. You don't say you eat sugar. I'm going to assume you don't take white sugar from a bowl and put a spoonful in your mouth, okay? But there happens to be sugar in your milk. There's sugar in your peas and carrots. Is that your clean? Well, if you're eating all of those carbs, then you can get insulin resistant. El Marie, I don't know what you keep saying, Doctor, please. I don't know. I don't know I can't go back and look at your original question. So if you have a question that I can answer, I'll let you know. Okay. Heather says, what diet do you recommend? I had to quit keto because of oxalates. Well, that means you were eating plants, right? So did you just give up the plants? Why don't you just give up the plants? And then that would be the diet that would be recommended. Habanero, that is getting, you're going down another rabbit hole that a lot of times I don't like to go down. But to answer your question, that particular poke does increase our risk of blood clots because it goes down the ACE pathway, angiotensin converting enzyme pathway. It increases our risk of blood clots. So yes, your fibrinogen and your D-dimer could go up after said poke. Exactly. Yeah, Henry, that's what I would ask too. What foods were you eating full of oxalates? Because most people who eat keto, well, you know what? I can't say that. You got to keep your carbs low. But if you're eating plant foods, like habanero says, is going to be high in oxalates. Patty asks, where is the best place to order blood work? You could go to ownyourlabs.com, ownyourlabs.com. You could go to lifeextensionlabs.com. You can go to altalabs.com. You could, there's a lot of them. I don't know what the best one is. Maybe someone here could, Henry says, I personally use Function Health. So there's another place. Habanero says, I had a high CRP in late February. A high sensitive CRP or just a CRP? Should you do an ESR? Maybe. Should you do an IL-6? Maybe. Thank you, Kay, for the $5 super chat. You guys, that's how we help the channel, and I really appreciate it. I know you might say, well, what's $5 going to do for you? But if $5, if 100 people give $5, then you have, yes. So it all adds up, and I do appreciate it. This is my job. I don't get paid to spend time with you on weekends for 4 or 5 hours. I do enjoy it, and I do appreciate you giving, you know, the super chats and the super stickers. So Original K, thank you. I appreciate that. So if you guys want to match that, that would be awesome. Here's your opportunity. Okay. Yeah, Rebecca, if you would like to sign up for a consultation, maybe we can go over more things. It's hard for me to answer it just with a little bit of information that was given to me. Robbie says, hey doc, I did a consult, then labs. I sent you an email to schedule a consult to review the labs. So just recently, Robbie? If yes, I don't recall getting anything from you, and I apologize because I have your email saved in my thing. So a lot of times, Robbie, I'm not saying this is you, but if you did and I didn't get it, it could have went to spam. And a lot of times I will just click the box, select all, and delete them. I don't always look through spam, and I apologize. Yes, my email address is iron, IRON, lady, LADY, ironladydoc at AOL.com. Ruth uses Own Your Labs and Ulta Labs. Hi, Doc. TJ says, why would the doctor tell my 18-year-old she has Hashimoto just because her TSH is 5.1? I am so upset. Yeah, that's good. You can really only diagnose Hashimoto's by elevated antibodies. So you get a TG and a TPO, a TG and a TPO. Patty says, I want to get a consult to know what blood work to get. Then you have a consult with me again. Is that possible? Patty, to save you some money, email me at ironladydoc@aol.com and I will give you a list of labs that I like to see. Is it possible to get them all? Maybe not, but I like to see a certain list of labs. It gives me a lot of information. If you want that list, just email me and say, hey, can you give me a list of labs that you like people to get? You don't have to hire me, even if you get those labs, okay? But if you just like a list, I'll send you a list. And then you won't have to sign up for a consultation just to get the list. Thank you, Lucy, for putting that up there. I appreciate it. Ben Bickman says macrophages can only consume small, dense LDLs. Macrophages, M1 macrophages, Henry. Remember, if you have a small, dense LDL, for the most part, it tells me that your immune system phenotype is M1 macrophage phenotype versus M2 macrophage phenotype. A healthier M2 macrophage phenotype would be better than having an M1 macrophage phenotype. The M1 macrophage phenotype is highly active in an inflamed environment, inflammation. And when people eat carbohydrates is the most common cause of getting small, dense LDLs. When small, dense LDLs are in the bloodstream and they enter into cells, if they do or not, but macrophages, the M1 macrophages that's highly active in this environment, is going to gobble up the small, dense LDL and make a foam cell. And that foam cell has been seen, viewed in plaque formation. Now, Ben Bickman, I think, is perfectly accurate, and he probably wanted to go down deep into the phenotype of the macrophages, but didn't. So yes, macrophages do gobble up. I call them Pac-Man. 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 Do you guys remember Pac-Man? The little, and then they eat up all the, yeah, that Pac-Man. It's a video game. Back in the day. Atari. Back in the day. Before, what is it now? Some fancy whatever, I can't remember. Yeah, back in the day when we were just, in high school, college, we had Atari. Or maybe we were in grade school and had Atari. Okay. Yes, those macrophages that gobble up the small, dense LDLs, yes, are involved in plaque formation. High small dense LDLs come from high VLDL. Yes, via CTAP. Henry, if Ben Bickman wanted to go down deep rabbit hole to explain this to you, he could easily, okay? I'm going to give you a very brief explanation of what Henry just said. Henry said, these macrophages consume small dense LDLs. In other words, small dense LDLs drive atherosclerosis. Yes, in his opinion, I agree. But there has to be an injury. A small dense LDL is floating around. If there's no injury, maybe there's no reason to get all in a tizzy, okay? However, high small dense LDLs comes from high VLDLs. Yes, 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 yes. When the liver packages up a bunch of triglycerides it loads it into something called a VLDL and then sends the VLDL out into the bloodstream. When it unloads its cargo, the triglycerides, the energy, its fuel for cells and tissues and muscles and all that, it unloads its cargo, it becomes an intermediate density lipoprotein. Then it unloads its cargo and it becomes a small dense LDL, or excuse me, an LDL. Forget, hold on. Take it back. So the VLDL gets sent out in the bloodstream. As it unloads its cargo, it becomes an intermediate density lipoprotein. Unloads more cargo, a low density lipoprotein. That LDL then delivers its cholesterol to the tissues that need it, cholesterol and cells. Now the LDL is supposed to go back to the liver and get recycled or eliminated in the bowels. If the LDL can't get back to the liver, the doors are closed, the windows are closed, the LDL basically circles the liver. That's the home base. If the LDLs are circling, there is a chance that the liver is still trying to make more VLDLs because there's a lot of triglycerides. You're eating a bunch of crap. There's a lot of triglycerides. So the liver is packaging up, and there's a lot of VLDLs in the bloodstream now, and there's a lot of LDLs in the bloodstream now, and now they collide with each other. When they collide, there's an enzyme called CETP, 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 I call it CETP. That CETP causes the VLDL to now put its triglycerides into the LDL. That is not a good thing. LDLs are not supposed to carry triglycerides. They are free of triglycerides. They carry cholesterol. The VLDL and the IDL should have already dumped off all of the triglycerides. So the LDL, when it takes the triglycerides in, now it can become oxidized. Another thing that happens is hepatic lipase, liver lipase, takes the cholesterol out of the LDL. And now basically the LDL is naked and it can get oxidized. It becomes a small, dense LDLs. Now you have a big inflammation environment. Along comes the M1 macrophages, eats up the small, dense LDLs, forms a foam cell, and plaque formation is said to occur. I know it sounds deep, but that is it. Habanero, thank you so much. Habanero just donated $5 to the cause. I appreciate that. Lucy says, Patty, yes, it is possible. You'll be very happy you made the decision. It's enlightening to have Dr. J go through your blood work. Thank you, Lucy. Pancho says, I was recently diagnosed with an abdominal aortic aneurysm. How many centimeters was it? And an enlarged aorta. So is that the same thing? Am I a dead man walking? Not necessarily. Do you have high blood pressure? Lower your pressure. Do you have thick blood? Unthicken your blood. There's a lot of things that could increase your risk of these, the abdominal aortic aneurysm. You got to keep watching it. And the aortic aneurysm, there's a lot to look into. And no, I don't want to say you're a dead man walking. Although we're all going to die, and we start upright and then we are laying down. Do you get a PDF with results or, oh, you guys are talking to yourselves. Okay. We're back. He's back. Okay. Lucy says she doesn't like Quest. Yeah, you can use LabCorp. There's always different choices. Okay, you guys are chit-chatting back and forth about Function Health. Oh my gosh, really, Kimberly? So Kimberly says that her man took the weight loss shot, probably Ozempic or Wegovy or Manjaro or some of those, and actually lost blindness or lost sight in one of his eyes. Yikes. Yes, Henry, agree. That is one doctor who talks about pulsing. But again, if you pulse the Crestor, the rosuvastatin, your low dose, 5 milligrams, 2.5 milligrams, whatever it is, 2 to 3 times a week. So you're going to block inflammation, then not block inflammation, block a thrombogenic potential or not block it. So are you going to get a blood clot and inflammation when you're not taking it? If you just pulse it up and down, up and down, up and down, does he know? Do I know? I don't know. I don't know if he'll admit that. I don't know. Oh, the O word. Yeah, likely Ozempic. Okay. He took it for 1 month and went blind. Oh my goodness. Oh my goodness. Henry, actually, you still have some estrogen and you need it. I'm guessing your level is somewhere around 20. I don't know. But just because you're a man does not mean you do not have estrogen. You do, and you need it. And you did not lose it at conception. Trust me. Patty, you look at all possibilities, which is what I need. A doctor who puts things together in pieces is rare. I agree, Patty. I was never one of them until about 3, 4, 5, less than 5 years ago. Original case says, why is ivermectin a banned word from Super Chats? I don't know. I can't answer that. I mean, a lot of times, yeah, they will have words where the person doesn't want to deal with that particular word, and then they put it in the hidden words. So if somebody says that word, then you can't even, your chat won't be seen. Okay. I'm going to send a super chat regarding an ivermectin compound, just so you know. Okay, I don't know if I see it, but okay. Okay, you guys are talking back and forth. If you have a question, please put a QQQ. Patty says, can 5 months of Cipro cause long-term gut? Yes. Number needed to treat for secondary prevention is approximately 25. Secondary prevention. That means you've already had an event, and I think it's actually in the 50s. Number needed to treat is, I think it's like 57. But again, it depends on what study you're looking at, okay? But that's after a secondary prevention. So that means you've had a primary event. You've had a heart attack or stroke. Now, how many years do you have to take? So you have to take the statin for 10 years. How many people do you need to treat for 10 years? I think it's in the 50s. Okay. What is the best diet in your opinion? Animal-based. On the run, I can't answer why your GFR is down to 10. Just by you asking me what would cause that. I don't know. Yes, agree, Henry. Some people think that eating potatoes is eating clean. Potatoes, bread, fruits are sugar bombs. I agree. Oh, I did not know that you couldn't put that word in the super chat. Okay. Please help me out. Is your question somewhere in here? Maybe Lucy knows where it's at. Oh, what is my opinion on using an ivermectin compound after a remission of lymphoma? I don't know if I have ever studied that, ivermectin, fenbendazole. I think somebody you should listen to Original K, would be somebody like Dr. Seyfried, who's studied these things. He's studied how cancers are fed. Has studied, do I have Hodgkin's clients who are taking ivermectin and they're watching their numbers? They're not doing any medications except very, very low carb diet, abstaining from fruit and vegetables, mainly eating animal based. And they're taking ivermectin. And we're in a waiting game and they're watching. I don't necessarily think that anything is ever really in remission. I think we have these things in our body all the time and we just feed them. Henry suggests Dr. John Campbell as a source. He just did a YouTube video on promising study that used both fenbendazole and ivermectin. Original case says my oncologist is very by the books because he doesn't want you to die on his watch. He gets paid to give you his medications and a good amount, and he gets paid to follow standard of care. He said he could neither confirm nor deny, but said I shouldn't stop what I'm doing, so I'm seeing if I can cut through his red tape and find someone off the record. I don't know. And again, Henry says, listen to John Campbell. I have listened to Dr. Seyfried talk about this. I'm pretty sure there's probably other doctors out there who have talked about ivermectin and cancer. I just haven't gone down that rabbit hole. It seems like I get stuck in the metabolics of everything. But again, cancers have a metabolic. So my thoughts are starve the darn things. I don't want them growing in me. Michael, that could be a way, but yes, I believe Christ will carry us off if you believe that your Savior is Christ. What I worry about is that Christ gave you the body to take care of because it's the temple that houses the Holy Spirit. And if we are given a free gift by God in the name that he gave, you can hop up. I'm not picking you up. Hop up. If he gave, he gave his son for you, and he gave you the free body, the temple, to basically do with what you want to do. But I think he asked in return that we would respect what he gave us. He gave us his son. He allowed him to be killed, tortured for us to take our sin because we couldn't fix it ourselves. So this body, I'm not going to stand on my head and drink wine and abuse my body because I think about what I do to my body, I'm doing to God, what I'm doing to the Holy Spirit. Now, you might not have that, and you might have just been joking, but stuff like that, I really take seriously. I'm very passionate about it. And as you may or may not know, I'm a very serious person, and I could have laughed about something like that, but I just don't see it as very funny because I love God that much. I love Jesus that much, and I don't want to disrespect him. And so I want to take care of this body, this temple, as best I can. And I don't know it all. I'm trying not to abuse it. I'm not going to smoke and drink and go motocross riding and take my body for granted. There's just certain things I'm not going to do. There's a lot of certain things I'm not going to do. Okay? I will avoid it at all costs. I'm not going to go work in a garage full of diesel fumes. I'm not going to eat sugar on a daily basis. I'm not going to eat processed foods. I'm not going to do these things. And I do that out of respect for my temple. And plus, no, I think it would be awful to have one of these diseases and we die. Get diabetes, get heart attack, get Parkinson's, get Alzheimer's. I know I have this dream where I'm walking upright and then I'm not. Okay. And then Jesus just came and got me. Hey, it's time for you to go home. Yeah. I love that maybe it's a fairy tale kind of a thinking, but I guess that's what I want to happen. I want Jesus to say, it's time. And what he says to me as we're going to the gates and we're before the chair and I'm down on my knees and he says, well done, good and faithful servant. Okay, that's what I want. And however he takes me, he takes me. Okay. Okay. I'm trying to get to the questions. Maybe we need to go over here. Okay. You Instagrammers. 2 months ago. Oh, you just sent the email yesterday. Okay. Robbie, I haven't checked my email today, probably. Okay. But I will watch for it. And it seems like it should be in my regular email, so, and not in spam, because we've already talked. Robbie says you should think about drawing your explanation so that we can see it visually. Which one? I will draw it. If I can draw it, I'll do the best I can, but which explanation should I draw? What are some natural ways to lower blood pressure? What are some natural ways to lower blood pressure? Lower your insulin. How do you lower your insulin? Oh my gosh, there's a lot of questions over here. How do you lower your insulin? Lower your carbohydrates. Own Your Labs is so good, cheaper than the one I use with my insurance. Good, 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 good. Save money. Save money, you guys. I can order your labs if you're in certain states, and I do get a little bit of a discount. So let me know. If you need me to order your labs, I can do that. Just email me at ironladydoc@aol.com. Oh, okay. Says Dr. William Mackis also talks about ivermectin and fenbendazole, and he does virtual consults too. So hopefully that will help you guys about the ivermectin, fenbendazole /cancer /COVID all of those things. I'm just not well versed. I have to admit it. I'm not well versed. I don't want to give you information and I don't know what I'm talking about. I don't know what I'm talking about. How do we starve cancer, says Yuli? Yes. Eliminating carbs and sugar. Most all solid tumors will eat carbs and sugar. Okay, so prostate, I believe is one that eats both glutamine and sugar. So Dr. Seafried will talk about that. Seafried talks about like pulsing glutamine. We need it. It's an amino acid. It's the most abundant amino acid and it gets depleted very rapidly. We need glutamine, but yet what if it's feeding a cancer? Oof. True Health says, amen. Thank you for sharing about your faith. Oh, you're very welcome. I'm not afraid to share my faith. You walk away, that's fine. Okay? I'm here to share the gospel. I've been commissioned to share the gospel, that Jesus died on a cross for us. He was buried, and 3 days later, he rose from the grave. He conquered death. For me, for you, for everybody, whether you believe it or not. He did it for everybody. We're all image bearers. True Health says, listen to Dr. Thomas Seafried. He teaches all about starving cancer with diet and lifestyle. Robbie said, when you talk about the transport of triglycerides in LDL, oof, I'll have to try to think of a picture. I don't know if I'll figure something out. I'll try. Another listener, Original K speaks of Dr. John Campbell. Original K gets ivermectin compounded in Tennessee. We used to be able to do it in Iowa. I don't know if they can do it anymore. Okay. Yes, 1910 Buddy is very cute. I just look at him and I think to myself, God granted me something that I've always kind of wanted. It's a short hair, black and tan. He's actually got a little brindle in him. You can tell in his paws and on his muzzle. And I look at him with his big eyeballs and I wonder, how did I get so blessed to get this little boy? Now, he is very timid. I don't know what happened to him in his past. He was an owner surrender in Norman, Oklahoma. And I don't know what happened to him. He's got a huge scar on his belly. I don't know what happened to him, but he's the most delightful little thing. But if I reach down and try to pet him, he will either pee himself or I don't know what happened to him. So we're developing, he hasn't only been in my presence for a couple of months, so it's going to just take some time. But when he loves me, he really loves me. And when he's scared and I make a fast move, or not even fast, I just bend down and try to pet him, he will cower and pee. And yeah, he's just getting used to having somebody who really cares about him and who has authority. Alpha. Henry says, Dr. Brewer's position of pulsing with rosuvastatin is because it has longer half-life. Okay, thanks for sharing. Okay. What about sweet potatoes? Sweet potatoes are sweet for a reason. Yep, 1910, I agree about the nightshades, which people don't understand. They love their tomatoes and peppers and eggplants and all of that. Oh my gosh. Patty says, my LDL's 120, triglycerides are 50. Is that a red flag? Not particularly, no. What is your HDL? Jack says, carnivore for 5 years. I have had dry scalp and dry red skin patches on my chin and around my nose and ears ever since I started carnivore. Histamine. Have you thought about histamine? Have you thought about mast cells? Have you thought about fungal growth? You're carnivore. Could you have low B6? Could you have low B1, B3, B12? Have you checked your B vitamins? Okay. And I would get all of them separately. That's what I would do. But you're describing something like seborrhea. Seborrhea, dry scalp, dandruff. And if you give an antifungal like Selsun Blue, it usually goes away. So the skin patches that are dry, they're red, they're irritated, could be fungal growth. Something like Nizoral shampoo. But why would you be getting these things? Could you have sebum built up? So I would get a DHT level. So look at your DHT. If it's elevated, then your sebum, your scalp needs to be exfoliated, even if you're bald, but exfoliated, the sebum carries DHT. And that sebum or seborrhea could be trickling down from your scalp onto your face. It'll get into your eyebrows, it can get around the creases of your nose, on your chin, even on your cheeks. Most doctors will say, oh, you got rosacea. Well, maybe not. But yeah, you could have a fungal overgrowth if you're eating carnivore and you're not getting good B vitamins. I mean, that's a possibility, okay? I don't know, but I gave you a few of my things that just popped into my head. A electric aura. Do you believe that there's a yeast overgrowth in guts yearning for sugar? Absolutely. Absolutely. The way to look, you could look at your B6, that the B6 level is what I was trying to get for Jack. H. pylori consumes B6. Fungal infections consume B6. Heck, you know what? If you have iron overload, it's going to cause all pathogens to grow. Parasites eat iron. Viruses eat iron, bacteria eat iron, all of them eat iron. If you have iron overload if it's stuck in your tissues, It's food for them. It's food. They're loving it. You give them a little B6 and they're as happy as pie and they're living rent-free on your body, in your body and on your body. Get an iron panel. Oh yeah, Henry, box breathing. Yep. So increases parasympathetic tone and decreases sympathetic tone as a cause of high blood pressure. So lower your insulin and do box breathing. Lisa says, my partner took a 2-day break from keto and since then has only had a maximum ketones range from 0.3 to 0.5. So somewhere between 0.5 and 3 is pretty normal on a ketosis diet. He might be using all of his ketones. You never know. Could be using them all. We don't necessarily have to have ketones in our blood to indicate that we're in ketosis. We could be using those as our energy. Your brain uses ketones, your heart's using it, your kidneys are using it, everything's using it. Electric Aura says, why is the EU and America ingredients so horribly different? I feel as if they're trying to hurt us. Really? Could that be? What do I recommend for iron overload? Well, I need to know that you actually have iron overload first. But what if you have a low copper problem? What if, I mean, there's so many things that I would look into with I first have to diagnose iron overload. Then we look at everything else and say, okay, your thyroid's okay. Okay, this and this okay, and this okay. Yeah, I look at everything. So it's not like I'm going to give you a medication and say, oh, this will fix your iron overload. I don't know. Is there a medication that you can take to just fix your iron overload? Or do we need your body to unload it from the tissue or the organ where it's stuck? Henry says the test for cancer via PET scan that detects radioactive glucose uptake. Most tumors consume enormous amounts of glucose. Moral of the story, minimize sugar intake if you have cancer. Electric Aura says cancer is man-made. They created this air, food, water, and maybe one day we will wake up to understand that. It's quite possible we could all wake up. 62 is your HDL, your triglycerides are 50. Patty, that metabolically looks great, but that's just those 3 parameters. They all look great. Yeah, habanero could be the soap and shampoo, but I doubt he changed those things. Henry says to Patty, which I agree with, but I have a caveat. Patty, your triglyceride to HDL ratio looks good. It's under 1. It's excellent. You are unlikely to have metabolic dysfunction. Correct. It is unlikely to have metabolic dysfunction and therefore unlikely to have much small dense LDLs. That's where I'm going to say you're wrong, Henry. I have seen carnivores have high amounts of small dense LDLs. So small dense LDLs, yes, most likely you're sitting in a metabolic dysfunction where trigs are high, HDL's low, sugar's high, insulin's high, yes. But the caveat, Henry, and this is where all of these carnivore people go wrong and say, oh, you're just a lean mass hyperresponder. Let's look into it. Look at an NMR or a cardio IQ. How many small dense LDLs do you have? When you are eating a lot of saturated fat, the saturated fat is going to downregulate the LDL receptors. That is going to leave LDL stuck in your bloodstream. If your liver is pumping out everything that you've been eating, packaging up with triglycerides to make ketones, you're making VLDLs. That liver's making VLDLs, and they're going to bump in and collide to those LDLs. That's why there's doctors out there that say just the pure number of LDLs is a traffic jam. And in a way, why don't you just go a little bit further and say it's your VLDLs? The VLDLs bumping into the LDLs via CETP and exchanging cargo. And then oxidation of that LDL causing a small dense LDL. So I have seen high LDLs. And the point of the story, you guys like that word, the point of the story is don't just assume, Henry, and I'm not getting down on you, just need you to be careful. I know you use the word unlikely, and I appreciate that. But I don't want Patty to hear, you're fine, okay? You may not be fine, even on a carnivore diet. There are people who are on a carnivore diet and have a heart attack. But again, we didn't look at the stroke or the blood clot factors. There's so many things that we didn't look at. And we just go, oh my gosh, they were on carnivore and they had a heart attack. Don't eat carnivore. We are reductionists by trade, okay? Karen says, do you know your blood type? Yes, I do. I have very high LDL and I seem to have high, small, dense LDLs as well. So hopefully I just answered your question. Henry says, thanks, Dr. J. Learned something new today. Didn't realize that carnivores could have small, dense, so high. Yes. Okay, good. Henry, thank you. Thank you for acknowledging. I just need people to be very careful that, you know, this lean mass hyperresponder, and I did a reel on this. We just need to be careful. The likelihood that you're a lean mass hyperresponder and you're going to live a long, healthy life, I'm great with it. But we just need to look. Okay, we just need to look. And if you're that person who's eating, and you admit, oh yeah, doc, I'm probably eating 150 grams of saturated fat a day. I love my butter and my ribeyes, and I'm eating 80-20 ground beef. You have a lot of saturated fat. And your particular liver can't deal with it, okay? So you get a traffic jam of all these LDLs stuck in your bloodstream. And all you have to do is just lower the amount of saturated fat. Just lower it. So if you're at 150 grams, maybe go to 75. Yeah, but doc, I need the fat. Then add in emu or lard or duck fat. They're much higher in monounsaturated fat, okay? Switch your 80-20 ground beef to 90-10. Switch your ribeyes and New York strips to filet or sirloin. Just make a little bit of a change and that LDL will come back down, okay? And so will the small, dense LDLs. Debbie says, I love and appreciate your passion. You're very welcome. Sometimes I really, I start to even overwhelm myself. And maybe we should, I don't know if there's any more, I don't see any more questions that I think I can answer without having to look them up, okay? The liver is a tricky thing when it comes to looking at your enzymes. I don't look at LDH as much, lactate dehydrogenase, but I probably should. I probably should look at that, but a lot of times I can tell whether you have sludge cholestasis, a fatty liver problem, by looking at an ALT, AST, and an ELK phos. I'll also look at a GGT, and for the most part, I can tell pretty clearly what things are going on. I believe that Dr. Ben Bickman speaks to LDH in his metabolic classroom, and even I probably need to go back and review or, watch it for the first or second or third time, and maybe you should too as far as LDH is concerned. Again, it is not a marker that I regularly look at. I'm not saying that you shouldn't look at it. I'm just saying I don't, and maybe I should. Okay? All right. Okay, guys. So I think this young man needs to do the, to do the thing outside and, right, Big Blue. You wonder why you got the blue, Buddy Blue? Well, you're a Michigan fan. You didn't know that? Oh, yes. And you look so handsome in blue. You're my Buddy Blue. So now I'm afraid that if I change his collar, because he's got two of them, one is black and red, and now he won't be Buddy Blue anymore. He'll be Buddy Black. But he's really not. He's Buddy Blue. Right? Okay. You guys, Lord willing, I will be back tomorrow, Sunday, 10 a.m. Central. 10 a.m. Central. Okay? Be back 10 a.m. Central, Lord willing. Every Saturday at 9 a.m. Central, every Sunday at 10 a.m. Central. Today, as a review, we spoke about gut health and really even how gut health relates to high cholesterol and how Lyme disease and H. pylori and all these infections and your stress and all of that can, and your diet, mostly diet, can mess with your gut and cause toxins to go all over your body. Okay? So instead of taking a medication to fight off the toxins, we just got to close the gaps. We got to close the doors and not let the endotoxins get away and get into the bloodstream. Stay in the gut where you're meant to. Fences are made to, or whatever that term is. Fences make good friends or something like that. Anyway. All right. True Health says, thank you very much. You're very welcome. You guys hit the thumbs up, subscribe before you go. Do all those things. And that helps the channel grow. Do I want it to grow? I'm not sure. One of my listeners said, Dr. Jensen, if you get too many clients, it'll be hard to schedule an appointment with you. Well, so far we're all good. You don't have to worry about that. I'm not going to take on so many clients that I can't keep up and do crappy work. Like a crapola diet, I do not want to have crapola treatments for you guys. It's not really a treatment. It's whatever. Okay. You guys have a blessed Saturday and we'll talk tomorrow. See you guys. Thanks for the waves. I appreciate it. See ya.